I really support most of the proposals made by my colleague minister from Zambia in a speech. First of all, I think we need to be sure that all the stakeholders involved, committed in all the issues we're talking about, are really involved in the governance bodies we're proposing. We have this opportunity of second phase to do it, and we have to be sure that at all the levels, which means national level, sub-regional level, and the continental level, we are involving all the stakeholders. And starting by African Union, I think we should have here really involved a second commissioner of African Union. I mean the commissioner in charge of human research and science and technology. He should be fully involved in the governance body of EDCTP. I don't know how we can separate the two issues, talking about health without talking about research, which means without science and technology. And at sub-regional level and especially at national level, we should also be sure of that. I don't think that we can achieve the goals we're working on, we're fighting for, if we don't really fully create conditions to have all the momentum, all the network which might bring all the nations to achieve the goals involved in the process. I mean, health ministries must be involved, but at the same time, you must have research and science and technology involved. At the same time, you must have civil society involved. At the same time, you must have also some other ministries in the countries involved. If this network is not really involved in the process, you will miss something. And right now, especially in my country, I'm very happy because we have some people really involved in the process, especially Professor Toumi. She's in charge of coordinating the program for Central Africa, and I'm very happy for that. We have very strong contribution from EDCTP. From the foundation, she's leading in Congo from health and research. We have some contribution for one of this research center. I'm in charge of the management and the governing. We have some contribution for university, but I don't feel that really in Congo, in national level, all the people we should be involved are really involved in the process. So, if this structure is not well done, so you'll have in national level government doing things, ministries doing things, working on the same issues in the same time, in a parallel way, and then EDCP will be in charge of doing some of or part of this program and not really being integrated in a virtual circle which will bring the achievement of the goals. So this is really for me a very important improvement we should work on. The second one is the same the minister said. The monitoring, the follow-up, and the feedback, the ability to evaluate, the ability to bring the ownership by all the stakeholders, and the ability to correct when the need is there. So this is very important. Very, very important. And I would like to just conclude my word by giving just some information about AMCOST. I'm coming from our second Bureau meeting where we have adopted a new strategy for Africa for the next 10 years for science and technology. This is a very important thing. We have asked the commissioner to make some improvement, and then I think the final draft will be adopted in Brazzaville in 3-4 months, where we will have the official session of launching this new strategy, including health research, obviously. This should be the African strategy for health research. This should be the foundation of everything which might be done in Africa in this regard. So I really think that we need to structure, to build a very strong link between AMCOST and EDCTP. Because the African governance now, for me, is very well structured. You have African Union, head of governance in Africa now. You have the Commission, and working with the Commission most of the time, you have African ministers. They have associations, they have bodies. There is one for science and technology on the other side. There is one for health. There is one for water and sanitation, and so and so. We have NEPAD, which is I can say the implementation agency of African policies now, and we have sub-regional economic communities. So really the network, the governance of Africa is now for me very clear. So we need to be linked to this governance which is becoming more and more efficient and not be out of that. Chair, I would like to stop there and let some time to my colleagues. Thank you.
Thank you very much for your points that you have made. As said, we will come back to get further clarification later. So I now invite the Honorable Professor Jacob Kaimenyi, Minister of Higher Education of the Republic of Kenya, to present.
Thank you, Madam Chair. I'll start by a clarification. My name is Gilbert Kokwaro. I'm a Director of Consortium for National Health Research in Kenya. I came here as a delegate, but my minister has unfortunately not been here. So like Charles said, he's used to ordering. He ordered me to come and represent him, which I'm quite glad to do so. So I'll take a very few minutes, and what I'll do, because I'm representing the minister, I'm not speaking on behalf of Kenya, but I'm a funder. I represent the largest funding private agency in Kenya. So what I'm going to do really are what I'm doing that from the lenses of a funder, but I think they will be accurate. I'll confine myself to official documents just in case I run into problems by saying things that may not be official government. But this is what I'll say. That A, Kenya is a significant recipient of past EDCTP funding. I think from what Michael showed me, it runs close to 30 million euros out of what Charles may have said. That's quite significant, and I'm sure on behalf of Kenyans, we are quite grateful for that. Now, to tackle the three questions, I'll just briefly say this, that for EDCTP to actually get a mechanism of engaging with the Kenyans, I think there are the four things that need to be done. Some of them are in place. One, to identify the regulatory and coordinating body. I'll tell you which one is that. To launch into an in-country funding mechanism which has got some legislative mechanism behind it. That is important. It's very, very difficult to get money out of the government unless you have some legislation to back you. Don't go by what is said at conferences. When you approach Treasury, they will be very reluctant unless they are sure they are working behind that. I'll tell you what Kenya has done that. Thirdly, resources are limited, and therefore you need to prioritize. So the country needs to come with two things. What are the health priorities, and out of that, what are the health research priorities? Those are the four things I'll do. So in terms of Kenya, the first question in your country, what policies are there that support HIV and to which EDCTP can latch into? There are two main documents that I think we can quote here. One is what is called the Kenya Health Policy 2012 to 2030. It's a very comprehensive policy. It has been driven by the Ministry for Health. It touches on service delivery, but more importantly, it also touches on research for health. How does EDCP actually gives an allowance for partnering with organizations like EDCTP. And I think that is something that EDCP can actually use as an entry point. The second one is a much shorter. It's called Health Sector Strategic Plan and Strategic and Investment Plan 2012 to 2017. Is a much shorter plan. And again, within those, I can say that whatever EDCT is planning to do in phase 2 are covered there. It's a good entry point. They are not as good as telling you what the priorities, but they are better than nothing. I think you can work on that. Now, in terms of funding, coming closer to in March this year, and I have some copies March only can take it. For the first time here, we Kenya passed an act of parliament which establishes a national research fund. Now, that is the legislation I was talking about. And under that, the country is now compelled to every year 2% of GDP, not the Ministry of Health, 2% of Kenya's GDP must be allocated to research. It means that quite a lot of money. It means, therefore, that health or research for health has got a window of opportunity. There's legislation behind it now. So it's not the question of negotiating. It's actually compelling the Kenyans to honor that. So 2%. Now, in that act, which you will say that there is again an option for the National Research Fund, the committee, to work with bilateral donors. And I think that's really the easiest route. Because for once, you will work with, I think with the committee, you will work with the technocrats. Or politicians will also come in. They are not bad people. But I think for Charles, I think you will work with technocrats. And one of the things that I think as a funder may work without any much bureaucratic barriers is actually identifying co-funded projects. How do I know that? I know that because last week or just 2 months ago, IDRC actually took advantage of that. And for the first time, IDRC is going to co-fund 2 chairs, one on health systems research and one on agriculture, 50-50 with the Kenyan government. It's moving very fast. And I'm saying that because of those enabling environment documentation, it's working very fast. I think there may be other options of EDCP engaging the Kenyan government in other things, but I think if you try this less bureaucratic route, because there's legislation behind it, there's guaranteed funding, that may be one way. But like I say, I'm speaking as a funder rather than a politician. Maybe you'll excuse me if I left any other details. I'm just being cautious that I'm not misquoted of having spoken things beyond what my minister would have done. I think I'll leave it there, Madam Chair.
Thank you very much for stimulating some questions to my mind. But we will move on and ask the Honorable Professor Nkandu, Minister of Chiefs and Traditional Affairs of the Republic of Zambia, to speak again.
Thank you very much, Madam Chair. I just want to say how thankful I am to come back again to maybe emphasize on some of the things that I had said earlier, but also provoke some thoughts as we continue deliberating on this very important issue. The first thing that I want to say is that when we are talking about health research and our commitment as governments to this research, we need to bear in mind in some countries that this particular issue sits in maybe 3 ministries or even 4. If I take Zambia as an example, we have the Ministry of Health that is speaking to some of these issues. Then we have the Ministry of Science and Technology also speaking to the same issues. Then we have the Ministry of Community, Maternal and Child Health speaking to the same issues, and my own ministry speaking to the same issues. So the first question that comes is, where do you anchor what we are discussing? So this we have to bear at the back of our mind, that we need to look for the best avenue. So, but majority of ministries, we are talking about health ministry versus Ministry of Science and Technology. So when choosing the participants, what is the best in terms of value addition? The second thing that I want to say, yes, Africa has so many regional groupings. We do have certain structures. This morning we are learning of even an initiative by the Ministers of Science and Technology where they have come together. But we are also aware that WHO has had similar arrangements. Again, what is the best way we get value addition? But even complicated is the bureaucracies in these institutions that make it sometimes difficult to move even on very simple terms. So maybe as Africans we need to learn from how a group of countries came together, established EDCTP, and have made it work. So how do we learn and put a structure in place that will work for the benefit of the people that we represent? I also want to say that there's been so much investment in Africa in terms of research, and we have had some very good results in terms of research. But research results are not meaningful unless they are put into policy and unless they are implemented. So how do we deal with linkages of the scientists who are sitting at the core of what we are discussing and governments? I'm glad that the previous speaker did say that politicians are not bad people. Indeed, politicians are very good people because they are the ones who make things happen. Without a policy, without financial contribution, we are nowhere. So really, I think that one of the things we need to unbottle is, first of all, a partnership in Africa between the stakeholders, especially between the researchers and the government leaders. So the government makes policy and also makes legislation that help in terms of things happening. So if we are to learn from EDCTP, we need to push for this on the continent, especially collective policies that will bring us together, like European countries have come together. But we also need funds to be able to contribute or organize groups that will contribute or help us contribute to the research agenda. But above all, we need the scientists to be able to carry out the research and give us back the results for us to be able to move forward. So in a nutshell, we need to deal with our bureaucracies. because they are really, really making us not move. Secondly, we need to formalize a formalized structure that speaks to all the impediments that have made it difficult for us to move where we are. And we have the regional groupings. We can go back to clusters like I was discussing earlier. We already have the networks of excellence that has brought together different countries to move the research agenda. Maybe that can be our starting point. To say which countries are in the West African centers of excellence, which ones are in Central Africa, which ones are in Southern Africa, which ones are in East Africa, which countries can move this agenda forward. So we do have a standpoint. We are being told that there is a body for ministers of science and technology. Maybe we need to examine that and see whether this can move. We already have WHO that has been in existence on the continent for a long time. Maybe we can look at that, or we look at a mixture of all this. The important thing is for things to work. And again, I want to say the time is now. Let's take advantage of EDCTP2 and put our feet in there. A journey of 1,000 miles starts with one step. And today is an opportunity for us to start that one step. Thank you.
Thank you very much indeed, Honorable Professor. I would like us to move on to the presentation of the Honorable Professor Mary Niane, Minister of Higher Education of the Republic of Senegal.
Merci.
Again,
Merci,
a representative.
Merci, Madame la Présidente. Je vais parler naturellement en français. Je suis le professeur Abdarahmane, doyen de la faculté de médecine, de pharmacie et d'odontologie de Dakar. Je représente Monsieur le ministre Itoua Nyan.
I represent Honorable Minister Nyan. First of all, I would like to wish you welcome to Senegal after the Minister of Health and Social Action has done so, and also wish you a wonderful stay in Dakar. In Senegal, health research in general, and particularly national programs to control diseases such as HIV, TB, and malaria are under the supervisory authority of the Ministry of Health and Social Action. But in terms of health research, the ministries of health and high education and research are very closely linked, and research is done under the authority of these two ministries. And since the establishment of the EDCTP program, Senegal has been participating in the various activities through its national programs, which actively collaborate with researchers from various research institutions, among which UCAD, that is the Cheikh Anta Diop University of Dakar. Various research projects are undertaken at the Faculty of Medicine, Pharmacy, and Odontology. There are also national research programs to control these three diseases, which are lodged in the hospital, the University Teaching Hospital, and outside this hospital. And at the level of the University Hospital, the programs are led by two eminent professors, namely Professor Mboup and Professor Achieng, here present. We have also received many visits from experts from EDCTP within the framework of these diseases control programs. And research outcome has helped us to refine our programs to fight against these diseases. Senegal has put research as a fundamental pillar of its development, and confirmed this recently within the framework of the National Consultation on Higher Education and Research, which was held in April earlier this year. And this was translated into a presidential guideline. And the President of the Republic therefore decided to devote 500 billion CFA francs within the 5 coming years to education and research. Senegal has also committed to make higher education and research the pillars of emergence of our country. And head of state has also decided in 2012, while handing over the Grand Prix of the President of the Republic for Science to equip all research laboratories of Senegal with financial resources. The commitment of Senegal is also translated by the adoption of a law on research and innovation, which will make it possible to build a national research and innovation program which is coherent and efficient. The establishment of a National Research and Innovation Council, but also the implementation of an appropriate program with performance indicators for the assessment of the national policy on research and innovation. There have been major steps taken by the President. There is also the establishment of a national fund for research and innovation, which funds research projects and which facilitates partnership between research institutions and the business world, among other missions. As was recalled at the opening session by this sector, Senegal is committed to fully participate in the second phase of the EDCTP phase 2. This participation will be done at 2 levels. In research projects, by encouraging research teams to apply for or submit their proposals during the various calls for proposals. As members, as a member, active member, Senegal will participate by making contributions in kind in the first step. In a second phase, it will participate in cash. Naturally, as soon as its financial resources will enable it to do so. Thank you. Je vous remercie. Nous allons passer à la présentation de Dr Sarah Achieng Opendi, ministre d'État en charge de...
Thank you very much, Chair. Just a small clarification. It's a doctor osmosis because I sit amongst doctors in the Ministry of Health. So that should be corrected. So ladies and gentlemen, my colleagues, the ministers, distinguished participants, I also want to voice to the previous speakers to thank the government of Senegal for hosting us for this important meeting. In Uganda, the HIV/AIDS, malaria and TB still remains a major public health problem. And of course, as a country, we have the health sector strategic and investment plan, which clearly defines the Uganda national minimum health care package that is expected to be delivered nationwide. And one of the priority programs within this package is the control of the communicable diseases, and that is majorly HIV, malaria, TB, and neglected infectious diseases. And I'm glad the EDCTP program focuses on the neglected infectious diseases in the next round. On the status of these three diseases, as a country, most of you are aware that Uganda, with the leadership of the HIV prevalence from 18% to 4%. Unfortunately, in 2011, the prevalence moved up slightly to 7.3%. And of course, right now, we have re-engaged the leadership, the political leaders, the religious leaders, to see to it that we bring down the HIV prevalence. We have also launched the elimination of mother-to-child transmission to ensure that no babies are born with HIV/AIDS. So this campaign is being led by the First Lady and involves all religious leaders and political leaders and everybody. So regarding TB, unfortunately, Uganda still remains one of the countries, the 22 high burden countries in the world. And it's estimated that close to 60% of TB cases are co-infected with HIV/AIDS. And we have about 100,000 new TB cases annually. We are also working on this to ensure that we reduce on these new infections so as to reduce the burden of TB in the country. For malaria, our climate still favors the perennial transmission of malaria. And of course, the government, with the help of development partners, has procured quite a number of mosquito nets, 21 million. And I think we may be a model country because we are now targeting all households, not selected groups of, as we have been doing before, mothers and children, but targeting the distribution to all households in the country. We also are doing that, of course, with the indoor residue spraying. And alongside that, we have the larviciding program, which is also going, although still on a small scale. So, ladies and gentlemen, Uganda as a country has benefited from the EDCTP. We have had various projects and clinical trials in the country. There are quite a number of them. Just to mention a few projects, we've had the early childhood transmission of the viral hepatitis B among HIV and non-HIV infected attending postnatal and immunization clinic. We've had the East and Southern Africa Research Network for evaluation of second-line therapy in HIV. We've had a prospective cohort study to prepare for HIV vaginal microbicide trial among sex workers in the city, that is Kampala, and various others. So currently Uganda ranks third after South Africa and Tanzania among the 30 African countries that have been successful in receiving EDCTP funding for research, capacity building, and networking. Results from these studies have provided valuable information to the Ministry of Health in terms of HIV epidemic. For example, the EDCTP funded projects have given evidence of the extent of the HIV epidemic in the fishing communities, with a prevalence 4 times the national prevalence. And the evidence that sex workers, especially those within the city in Kampala, have a very high HIV prevalence, 5 times higher than the national average. As a result of all this, the 3 countries in East Africa have set up a consortium, the Lake Victoria Fisher Folk Consortium, to conduct further health research in these populations still harboring HIV hotspots. Another example is the ANES project that is conducting the largest clinical trial in Africa that compares second-line regimens containing boosted protease inhibitor in patients failing first-line therapy in Africa. The study will provide definitive evidence that will directly influence national treatment guidelines and the worldwide public health approach to the ART rollout. Of course, there are other studies. I will not get into that in the interest of time, since I've already been told how much time I have. So as a country, we have also benefited from the infrastructure and human capacity development. As an example, at the Uganda Virus Research Institute alone, we have achieved the following: a DNA sequencer which can type HIV and also direct the HIV drug resistance as an important test for patients on antiretroviral therapy. We've also benefited from the IT capacity at the Uganda, as the IT capacity at the Uganda Virus Research Institute has been improved. The EDCTP provided funds to expand the HIV vaccine trials laboratories at the Uganda Virus Research Institute. And it's also supported the creation of the Central Molecular Laboratory and very important international laboratory accreditations, which are required for better service provision and high quality assurance. Under the human capacity development, several Ugandans have been trained and attained master's degrees, PhDs, postdoctoral levels and through many skill sharing workshops in best laboratory, research, project planning, and financial management practices. We've also benefited in ethics and regulatory strengthening. The ethics committees at various institutions have been set up and supported. We have also been able to have African regional networks of excellency. A recent development was the creation of the African regional networks of excellency, recognizing that sub-Saharan Africa is still faced with the challenges of inadequate research infrastructure and lack of a critical mass of researchers for health. With many researchers working in isolation, there was a need to strengthen the South-to-South collaboration and to map and synergize research efforts across disciplines, institutions, and countries for wider impact of results. EDCTP supported the creation of the 4 African-led regional networks of research centers that are involved in clinical trials. These networks of excellency are facilitating regional collaboration and coordination by uniting diverse institutions that bring their individual strength to a robust network. By collaborating, health professionals are learning and developing, thereby raising the quality and volume of the health research and practice. We now have the East African Consortium for Clinical Research, and its aim is to strengthen clinical trial sites in East Africa, thanks to EDCTP. So, ladies and gentlemen, Uganda is very proud to be an active partner in various EDCTP activities, including steering the EDCTP Secretariat Office in South Africa, which is led by Dr. Michael Makanga, and hosting the Secretariat for the East African Consortium for clinical research at the Uganda Virus Research Institute in Entebbe. The government and its institutions have been very supportive to its EDCTP activities, including providing co-funding, offering access to its experts and facilities. We have the malaria vaccine trial site in Mayuge district, one of the districts in eastern Uganda. Uganda as a country notes that most funding for health research and EDCTP activities comes from the north. For sustainability, the countries in the south have to make additional financial resources, contributions. As mentioned earlier, South Africa has taken the lead in that for every euro from the EDCTP, the South African government has added a euro in form of co-funding. Tanzania and Kenya are in advanced stages of discussing ways of co-funding the EDCTP activities within the East African region. And Uganda as well has been supporting the activities, and I want to make a further commitment that we shall make contributions to the EDCTP2 activities. And maybe just to inform you that the Uganda National Council for Science and Technology, a Millennium Science Development Fund has been put in place with support from His Excellency the President, and therefore you can see that the activities are supported at a very high level. And this fund is critical for research proposals, especially this will help fund critical research proposals, especially in areas of control of the communicable diseases. In addition, through an act of parliament, the Uganda National Health Research Organization has been set up to spearhead the coordination of research, develop research agenda, and mobilize funds to support research. Uganda, therefore, will advocate for possible funding mechanisms at regional level. We have the East African community. We will definitely also move to advocate for support at this level and various other levels. We pledge to support regular national and regional meetings with health policy makers on critical issues aimed at discussing gaps in health and policy research. I therefore, ladies and gentlemen, reiterate our support to the proposal by the Minister from Zambia for Africa to be represented at the General Assembly. And of course, to cement a stronger partnership with the relevant structures at the different levels, at the East African community level and at the regional level. And also we have the proposed East African Community Health Research Commission. This will be possible through the liaison role that the Ministry of Health, I'm therefore speaking on behalf of the government of Uganda and the ministry as a whole, and through the representation of the East African, the ESCCCR selected members on the committees mentioned. So ladies and gentlemen, Uganda will be pleased to further strengthen its participation in the governance of the EDCTP. Currently, Uganda is very proud to be an active partner, as I mentioned earlier, in various activities of this partnership. And of course, we'll be happy to nominate a Ugandan to serve in the EDCTP governing body once we are given an opportunity. Thank you very much for your kind attention.
Thank you very much. I'd like us to move on to the Honorable Mr. Omar Say, Minister of Health of the Gambia.
Thank you, Madam Chair. On behalf of the government and people of the Gambia, want to thank the organizers for this very important meeting, and by extension to the Republic of Senegal for hosting this meeting. In regards to our national programs or policies, in the Gambia, we have well-established structures to support HIV/AIDS, malaria, and tuberculosis, the three poverty-related diseases. There is a national malaria control program, national leprosy and tuberculosis control program, and a national AIDS control program. The National AIDS Control Program is supported by a robust National AIDS Secretariat under the Office of the President of the Republic. These programs are well established, each with its own up-to-date policy and strategy plan. Our tuberculosis and malaria programs currently benefit from EDCTP through the one-time and one-time plus, particularly in terms of staff development. And this we really appreciate. The Gambia government and the Medical Research Council Unit, the Gambia, continue to work as genuine partners in clinical research and capacity development. I have been involved in trachoma and malaria research, working with the MRC for almost more than 20 years now. The Gambia government, through my ministry, is committed to the establishment of a national health research program to combat tuberculosis, malaria, HIV/AIDS, and other poverty-related diseases such as childhood pneumonia, meningitis, and diarrhea. To this end, we look forward to the continued support from the EDCTP. My ministry is well aware that capacity strengthening and infrastructure development are key ingredients to a successful health research program. In regards to support and promote national ownership, the Gambia government's position is very clear. The Gambia is committed to creating a conducive environment to promote national health research, as I have already indicated. We have a health research unit under the Directorate of Planning and Information in the Ministry of Health and Social Welfare, and we are working on a health research policy. In the Ministry of Health and Social Welfare, there's a young national public health laboratory in which is embedded national reference laboratories for tuberculosis, HIV/AIDS, and malaria. The government of the Gambia is very supportive of the EDCTP concepts, mission, and vision. We subscribe to the idea of a regional approach to support the EDCTP. I personally undertake to initiate this discussion with my government at cabinet level and to propose this matter as an agenda item at the next West African ministerial meeting. I assure of my ministry's commitment to these discussions at cabinet level and West African ministerial meetings, and you can count on my unflinching support. Thank you very much.
Thank you. I will now call upon the Honorable Advocate Michael Masutha again to present for South Africa, the Republic of South Africa.
Well, thank you, Madam Chair. The one point one wants to highlight is that it is critical for countries at a national level to participate directly, because that would ensure that countries actually prioritize this area of work, and therefore also commit material and financial resources to support the work. I found the example of Kenya interesting, of legislating the 2% for innovation. We have a policy commitment, both at the level of the ruling party and in terms of our innovation, 10-year innovation strategy, for an initial target of 1% of GDP. The challenge in recent years has largely, our statistics indicate that there has been a reduction in investing in innovation, but our analysis is that much of that reduction is accounted for in the private sector component, but that the public sector component has remained strong. Some of the arguments that are being put forward as reasons for the reduction in support of research and innovation funding is to do with some of our big corporations going global and moving their headquarters elsewhere in the world, and of course then the innovation within those companies being located elsewhere outside the borders of the country, and of course the economic decline of the 2009 further on also had its own impact. We are looking at a proposal nationally of consolidating our budgetary system in the public sector under science and technology relating to research and innovation, because of an observation that very often line function departments that deliver services tend to focus more on the actual rendering of service rather than innovation and research. And even though funds would be allocated towards research at the level of implementation, research tends to be the first victim when it comes to redirecting of resources. I don't think we have the kind of mechanism of prescribing to the budgetary system by statute percentages in similar vein as Kenya. But I think there are other ways in which we could ensure prioritization. The reason why we actually have a ministry of science and technology as a standalone of our commitment as a country to ensure that research, innovation, development are prioritized, and a dedicated focus is given to that specific area, because of the obvious reason that underpinning our development goals, we do need to develop the human capability. We need to develop strong research institutions, and that can only happen through a dedicated focus in this field, and making sure that resources, once allocated, are ring-fenced and protected to support research. And of course, co-funding is key, or co-investment in this regard. Partnerships are about, all partners to the partnership playing their bit. You cannot really succeed if you yourself do not commit to supporting. I just also wanted to highlight the fact that when our current president, Jacob Zuma, took over government after the 2009 elections, in his first State of the Nation address, he ushered a new national approach to HIV and AIDS. We had our own reputational challenges before that, which you all know about, and we were determined to change our whole focus on this. And to date, we can proudly say that out of the how many, 4 or 5 million infected people, at least 2 million are on antiretrovirals, which constitutes just about 80% of those that qualify to receive treatment. So it is the largest treatment program in the world. Of course, we are amongst the highest bearers of the burden of the disease. So for us, it's about the survival of a nation, and that's why we're taking this matter seriously. The issue of innovation in this field, therefore, is not a by-the-way issue for us as a country. It's a survival issue for a nation. So I think that is the context in which we will continue to stand ready to support work in this area, increase spending in this area. And of course, we feel that for the contribution that we have made, not only for our own national interest, but to really strengthen the African participation, would advocate strongly that we be given the opportunity to participate directly in the governance structure, so that we are able to bring on board our capacity, our technical capabilities and resources to bring to bear overall in supporting the program. Thank you.
I'd like to say thank you to all the ministers who have presented. There's no doubt that each country represented here has expressed their commitment in terms of political commitment to the efforts of EDCTP, and also to continue to support and promote ownership. I do have to say, however, that as I have heard, Senegal has mentioned how they propose to address the third question, which is the question of regarding participation in the governments and making contributions in cash or in kind. And they have presented suggestions as to how they would move forward on this. South Africa has reiterated this in terms of their co-funding plans. And the Gambia also has told us how they want to take this matter to the next step of to the West African Regional Committee meeting. So I'd like to hear a little bit, if we may, from the other participants who have made their statements about the regional organizations and other bodies. I'd like to know what the next step from here would be to be able to take this matter forward. So Might I dare ask the Honourable Representative from Zambia to give a comment on that? The next step.
Thank you very much. I did say myself that I think we need to look at the value addition of our next step. I believe myself in the fact that there is merit in numbers. And I think that Africa must be represented as a continent. And as a next step, while it's very easy for me to say that Zambia will participate and in committing itself, but I'm worried about other countries that may be left behind. And what I learned from this table is that, for example, we have commitments that have been done through, I know that for a fact, through the World Health Organization. But the coordination, feedback mechanisms, voices, has been a bit unwavering. Today we learned that there's also an effort through the Ministers of Science and Technology. And I would like to suggest that as a next step, we first of all put our house in order as Africa, and maybe convening the Ministers of Health and Ministers of Science and Technology to have one position may be a way forward. Secondly, I also believe that we already do have systems that have existed under the EDCTP through the different networks of excellence. That to me may be a good beginning to say the countries that are participating, if they could then look at representation from these countries, because these are countries that are already participating, they are committed. Maybe that will be one way of moving even a bigger step into getting into the GA. I am a bit worried myself of committing individual countries, and maybe as countries we start benefiting from sitting on the GA, then what happens to the rest of Africa? So this is a very, very searching question. And the reason I wanted to speak on behalf of the continent. So we need to find a mechanism very quickly before the implementation of EDCTP2 that brings Africa together. I was a bit, let's do it through the structures of the AU, because I did mention the issue of bureaucracies. And I think we want to move quickly on these things. But the AU is represented here. They can probably say how they think they can move, because the past efforts have made it a bit difficult because of the mechanisms that are there. So in terms of committing my country, I can say today that I commit Zambia, but what happens to Swaziland? What happens to Lesotho? What happens to Namibia? What happens to Malawi? Because for me, Southern Africa, which I represent here, will only be liberated if all of us are participating. And I think we need to find a mechanism that makes us all participate. If South Africa is going to go, if Zambia is going to go, if Zimbabwe is going to go, they are carrying the voice of Southern Africa. If the AU is going to go, they are carrying the voice of Africa. And I think for me, that is the issue. Having sat in the EDCTP and seeing the disconnect of governments from the science and the good work that EDCTP has been doing, we need to find a mechanism that works for us. And if we're going to succeed in the manner that I would like to see, I think for me that is very, very critical. Thank you.
Thank you very much. The Honourable Representative from Congo, would you like to address the question I posed?
If you allow me, I will do it in French. I want to be sure that I'm using the right words, because now it's critical. Oui, Madame la Présidente, merci, parce que on touche là à un point important. Et je dois dire que j'appuie beaucoup de choses que ma collègue a dit. Je crois que nous devons absolument examiner les choses aux 3 différents niveaux.
3 different levels, national level, sub-regional level, and a continental level. I also believe that we need to find a way and means for Africa to be represented, because at continental level, continental policies are designed. We cannot fight against malaria with just a group of countries, however their wealth. We need to work out, design an African policy against malaria through clusters, so that the whole of Africa contribute to the fight against malaria. And I believe that the work is underway. There is bureaucracy indeed, but there is a new dynamic at the AU, and we must recognize it. So Africa must be represented. Africa can be represented through its different commissions, the Commission for Social Affairs, on the Commissioner for Science and Technology, but both commissioners should talk, and by exchanging they should give us a vision of unity in Africa. And in doing so, we must avoid bureaucracy. And the regional economic communities can help us avoid bureaucracy. Therefore, this community should be represented at national level. Before we talk about representation, we should involve all stakeholders. All stakeholders be involved in the follow-up processes. We're talking about public health. We're talking about HIV/AIDS. We're talking about malaria. We're talking about TB. And malaria is the single most killer disease of children age 0 to 5 years. So these are main issues, and we must make sure that EDCTP engage with stakeholders that know the issue. I'm here with the Director General of Health, Mrs. Tumi is here. She's the regional coordinator of the ECTB program for Central Africa. I'm here with the person responsible for the fight against HIV/AIDS. So my delegation is composed of different stakeholders. And when I go back home, I will engage with my colleague from the Ministry of Health, from the Ministry of Higher Education, and together we will get organized to take EDCTP2 on board. And obviously, Congo chairs COST. We coordinate the regional EDCTP program. If we get a representation at national level, we'll be very happy. And I'm even ready to invite the next EDCTP meeting in Congo. We are prepared to host it. But the individual commitment of states should not close the door for others. There should be no gap between the states. The individual commitment of the states should go along with a financial and a scientific commitment. We should be, when you want to be at the General Assembly, you must commit yourself to play a major role at the EDCTP. Well, if that is the case, we can have representation at continental level, representation at sub-regional level, but also national level for countries like South Africa, because South Africa is an active player in health issues. Well, there are countries that have made a lot of progress, and these countries can bring their experience to bear. But this commitment should go along with specific commitments, and Congo is ready, able, and prepared to play this role. Thank you, Madam Chair.
Thank you very much indeed. Yes, if I could just hear very briefly from the representative from Uganda as to what your next steps would be to take this discussion forward, it would be useful. And I do want to open the floor to others, so I will ask you both also very quickly to Gambia, you've already said, but Kenya, I'd like to know. So thank you.
Thank you very much. Uganda certainly has made various commitments at continental level. Recently, when we had the heads of state meeting that was held in Abuja, I think it was in July, we recommitted ourselves to the Abuja Declaration. And of course, we recommitted ourselves to focusing on the 3 diseases linked to poverty, that is TB, HIV, and malaria. And of course, the activities of EDCTP are very much related to the various interventions that we are making as a country in regard to these 3 diseases. And the pillar of the health system strengthening and investment plan is evidence-based formulation and programming. And in line with this, certainly the Ministry of Health provides funding to support research activities in the country. Therefore, we have also put funds to support the activities of UNRO. UNRO is the Uganda National Health Research Organization. We have the Uganda National Council for Science and Technology, where a Millennium Science Development Fund has been put in place and I did mention this was with the support of His Excellency the President, to fund critical research proposals, especially in the control of the communicable diseases. Therefore, as a country, we are committed, and we will definitely put aside monies to contribute towards the EDCTP 2 as proposed. So, of course, we cannot speak for the other countries within the East African region, but Uganda pledges to take a leading role to ensure that we speak with the same voice, we speak one language, and we all support the EDCTP 2 activities within the East African region. I can state for now, thank you very much.
Thank you. Thank you very much for the clarification. It is very clear. Could I get, I would like to know the next step. You often talked about, wondering what your next step will be, taking the discussion from here.
Thanks, Madam Chair. Let me again reiterate that really I cannot speak on behalf of the Kenyan government, but I can speak as a committed Kenyan on what I think should be done. I'm a funder, a small one, but I think a very significant funder in Kenya. So what I plan to do from January 2013 is to facilitate the process of 2014, is facilitate the process of Kenya establishing research for health priorities. They have not done it. Tanzania have done it. We have not done it. I think once we facilitate that, then it will be easier for EDCTP and other funders to align their programs, especially to our priorities. Because always, if you hit a drum that is always familiar to the villagers, they will support you. At this stage, we don't have that. So if we can do that, but I can always say this because I'm the director of the funding, so this really, they have authority. I'm prepared to co-fund in whatever small with any other funder and a program that is aligned to what we are doing, because I think, like someone said, that we do too many things, too much duplication, and we are not moving forward. If you fund and we find, for example, someone can take infrastructure, someone can take capacity building, someone can take knowledge translation, it adds. I'm prepared to work with EDCTP to co-fund, but I'll hope that in the process we will, I think that's the answer you are trying, in the process we will persuade the Kenyan government also to come and fund a component. That way, we can assure sustainability. I think it's not going to be sustainable until people put in something so that they value it. So I think really that's really should be the way forward.
Thank you. Thank you very much indeed. I'd like to open the floor for questions, comments. The representative from Tanzania.
Yes, thank you, Madam Chair. Maybe I wish just to remind the participants that in 1980, African, by that time, Organization of African Unity, made a resolution of contributing 1% of GDP into research and development. And this actually didn't happen. In 2007, again, resolution was made in Addis Ababa that African states should contribute 1% of GDP into research and development. This didn't happen. In 2008, at the Bamako meeting, there was again a Bamako call for action to contribute 5% of the donor funding, or 5% of the donor funding in supporting research and development in health, but that didn't happen. So I don't know which resolution we are waiting again. I now can speak on behalf of Tanzania that Tanzania is committed to spend 1% of R&D into research and development. And for EDCTP in particular, we first of all acknowledge the achievement of EDCTP1. We are also very happy to see the development of EDCP2, which is in line with our national research priority. Currently, our funding for research, we are supporting almost 400 scientists to pursue a master's and PhD training. We are also supporting, we are rehabilitating research infrastructures in 20 research institutions. We are supporting 50 research projects in Tanzania. We have also a number of bilateral programs which have started with South Africa. We have recently supported, we have a specific program on research cooperation with South Africa where we contribute equally. We have also support with other research initiatives with supporting, for example, to stimulate postdoctoral program with Netherlands and Sweden, where we're also contributing equal amount. So for this kind of a country which is moving like that, it's may not be ideal to wait for others to make the decision. So if you cannot commit the funding at national level, how can you commit funding at regional level? So since we've been benefiting substantially on EDCTP2, I would like to pledge that Tanzania is committed to provide both political, direct and indirect support for EDCTP2. And we believe strongly that we can also participate from country level, like what our colleagues in our South Africa has actually alluded to. Thank you.
Thank you very much indeed, and for this, and you will get another chance to reiterate it in the next session. Please.
I am sitting behind the Gambia label. You'll notice that there's no Gambian flag. So I'm not speaking on behalf of the Gambia government. I'm speaking on my own behalf. And in fact, I have questions to ask more than anything else. It's, first of all, it's how many African countries can the EDCTP actually accept as members? All 47? We're talking about a union of European countries, and we want to match that with individual African countries. To me, it makes sense that given that the health priorities within Africa are similar within our regions, that we should take a regional approach to attack this problem. And to give you an overwhelming African presence, perhaps the AU, WHO, Afro, and NEPAD could then join in, making a sum total of 7 countries, but representing Africa in general than individual African countries. Thank you very much.
Thank you for that intervention and the clear suggestions. Are there any other comments at this stage, please?
Thank you, Madam Chair. I want to make a few comments and also a suggestion, and then I have also one question on the way forward. First of all, to congratulate EDCTP for EDCTP1 and the great achievement, and also for organizing this stakeholder high levels meeting, which is actually an eye-opener, I believe, for particularly in getting African leaders and countries to participate more in EDCTP. We also need to acknowledge, which EDCTP have done also, that really, even up till now, African countries have participated, particularly contribution in kind. First, by the infrastructures already built in Africa, which has been made available. Some of them have been improved, and also by the nationals that have participated also in the different clinical trials. And on the other hand, African countries also have benefited a lot by the number of career development trainings that have been provided. I think I want to agree with the minister from the Congo Brazzaville that because Africa is very complex, we are very complex, we should recognize this. So there should be 3 approaches, like he has said. There should be effort at national level. So countries that are represented here, we've seen the example from South Africa, we've seen the example from Tanzania. I'm really impressed that Tanzania announced here that they've awarded to support about 400 students for masters and PhDs on their own funding. That is a very great commitment. And I don't know how many African countries are doing this. So that is a very strong step. So at the national level, I think the ministers that are represented here need to go back to their countries and see, just like the Gambia have suggested, and see how at the country level they can support EDCTP. And support means really contributing in cash, I believe. This has to be whatever is the amount they want to contribute to EDCP2, because from EDCP1 we can see many European countries matching funds contributed by EDCTP. African countries also can do this. If not matching dollar for dollar or euro for euro, you can match at whatever rate. That would be a very important thing that they can do with whatever resources that is available. So at the national level, action has to take place. And for the ministers here, I think the onus is on them to go back to their countries and see the mechanism within their own government, within their own leadership, and see how they can contribute. So for countries that are represented here today, I think there is a challenge that we expect to hear from them at the country level, what they want to do specifically for EDCP2. At the regional level, we also need to recognize this, because Africa has very powerful and effective regional bodies. At that level also, there is need to have clear-cut action on what needs to be done and how they want to support EDCP2. And again, financial commitment has to be part of it. At the Africa as a whole, African Union level, this also has to happen. I think in fairness to EDCTP, they've really ensured that Africa is represented on the GA level. I think that there are 1 or 2 African representatives there. Maybe there is need for more, but the mechanism needs to be worked out. But at the African Union level, there must be commitment also towards EDCTP2, because we are benefiting from it. And lastly, I want to say, really, I'm a Nigerian, and I am really surprised and also embarrassed a bit that I don't think Nigeria is represented here. I don't know how this happened. Maybe they were invited and they are not here, which is possible. But Nigeria really is a very big country, and both in terms of public and private entrepreneurs, we have individuals that can support programs like this. So, as has been acknowledged here, particularly by the Honorable Minister from Zambia, maybe the communication between EDCTP and African governments is not optimal as of now, in which case awareness of the contribution of EDCTP to Africa as a whole and individual countries, maybe this is not being communicated enough or being emphasized enough. So there should be a mechanism. So I'm wondering why Nigeria is not here, because truly I think we need to acknowledge that Nigeria also needs to contribute, both in terms of our population and also in terms of our resources. Thank you very much.
Thank you very much. Could you just say who you are? And yes, you said you're from Nigeria, just for the record.
Okay, I'm Abdarahmane Alabi, and I'm currently working in Gabon at the Center for Medical Research in Gabon, part of the Albert Schweitzer Foundation Hospital. And just an example of that, Nigerians were all over the places. Thank you very much.
So I think we take one more comment and then we will break for lunch. Please, Cameroon.
Thank you, Madam Chair. I'm Senator Kula Shiro. I'm the Permanent Secretary of the Ministry of Public Health. I wish, before I'll give my talk later on this afternoon, I think, first of all, to say that I agree. I was very happy to hear from the different keynote speakers And one important issue which was mentioned and on which I want to reiterate, it's the fact that during the EDCTP1, the government was not very much involved in the different issues, in the different, whether it be at the regional or the sub-regional networks of excellence, which made it a little bit difficult for ownership by the governments. And if we have to build on that, learn from that lesson, of course it means that the different governments will need to, as we are doing now, I think that's what the EDCTP2 is based on, the ownership by different governments and contribution. Of course, it's the governments that need to contribute. Well, the second issue is on the representation of the different governments at the level of the EDCTP General Assembly. It seems to me that it would be more equitable that different sub-regions be represented already as we are in the Afro region, meaning that at the regional level, some sort of organization, I will look at the World Health Organization, and of course the other organization, but it's important that the sub-regions be represented. And of course, if we look at how sub-regions are represented in other funding mechanisms, I take an example. Before, I don't know how it is now, the Global Fund. The regions are represented, and then there is some sort of rotation. And so that is very important. They meet, they select based on certain criteria, and of course there is rotation, and that's what I call equitable participation of all the countries, so that we do not only select, of course, based on we need to have some sort of criteria that permit people to represent these countries with power. Because what used to happen, I really take the example of the Global Fund. I know that at the beginning, one or two countries represented West African and Central Africa. And for 4 years, there was no feedback in the different countries, and people were not aware of what was happening. And immediately this mechanism, now people realized that it had to be in a rotative manner. People became aware, and then people, there's some sort of, you have to give response. You have to, how do I say it? You give back, you give information on what has been said and what has been decided. There's accountability to the different countries. So that's it. And then, of course, the countries that need to represent need to have had at least some mechanisms put in place, or some, of course, it's true that you cannot eliminate those who do not have research going on or who do not have mechanisms, but they should be helped to be able to put those mechanisms in place. So those are just the issues I want to mention, which, of course, so that I will not come over it again, since we are already at the discussion level. Thank you.
Thank you very much. Okay, so I think that the discussions have definitely started well, and we will break now for lunch, and lunch will be at Salon Vert. It's located on level 1, and there will be ushers that will show us the way to this room. We will reconvene here just before 2 o'clock, so we can have a full sort of roundtable discussions in the next session. Thank you very much.